Hey guys, welcome back to my channel. So you all of you must have seen the COPD patients in your OPD or in your IPD while practicing. So the thing is, should we over oxygenate the COPD patients? Everybody knows that we don't over oxygenate the COPD patient, and we know that our target saturation in the COPD patient is around in between 88 to 92%, isn't it? So if a patient is there who is having the COPD, and you are planning to discharge that patient, but the thing is, this patient is having the oxygen saturation of 85 to 86% on room air. I am saying this, okay? The patient is on room air, is not requiring any oxygen, but 85 to 86%. By the way, when do we give oxygen to the COPD patient? We give the oxygen to the COPD patient when the saturation is below 88. In those scenario we give, otherwise 88 to 92% is the permissible oxygen saturation of COPD patients. So if the patient is having 91-92% of oxygen saturation, do not give them oxygen, as it is not useful for them. I will make a separate video why it is not useful, or rather it is dangerous to give the oxygen to those patients of COPD who are having the saturation of 90 to 93% on room air. So we do not need to over oxygenate them. However, if there is a patient who is having a oxygen requirement, for example in this case where the 85 to 86% of saturation is there on room air, and you are planning to discharge that patient, then in that case you need to give oxygen supplementation to that patient on home basis. So we are having many patients who are requiring the oxygen support at home as well, and we need to ask them to arrange the oxygen at their home, right? So this is called as the prescription of supplemental oxygen in COPD patient, and we should be very careful while making the patient and family understandable that how they should use it oxygen judiciously at home, because over oxygenating the COPD patient can again cause the readmission of such patients. So over here what you need to do is that we know that target saturation is 88 to 92%, right? That should be the target, and that should be clearly uh, delivered this message. We should clearly deliver this message to the family members and the caretakers of that patient, that oxygen saturation should be in between 88 to 92% approximately. Okay, so while they are giving the oxygen, at in what scenario they should be giving the oxygen to the patient, and secondly they should not over oxygenate the COPD patient. So we in the scenario where the patients are not able to maintain the oxygen saturation above 88, I'm talking about the COPD patient. In those cases we can prescribe them oxygen. The oxygen is also a drug, so we prescribe that, right? So in those scenario what you will do is you will do a ABG here. Okay, so what I will do is that I will be doing the ABG, and in the ABG there are certain values, pH, PCO2, PO2 and all of these things. So I will be in the ABG, I will be searching for the PO2. I will be looking at the PO2 over here. If the PO2 is less than 55 mmHg, right, and or the saturation is lesser than 88%, right? This is the first scenario. Or if the patient ABG shows PO2 value of between 55 to 60 mmHg, right, along with right sided heart failure or core pulmonale feature, right? The patient may have pedal edema, the patient may have distended neck veins, the patient may have cardiomegaly in the chest x-ray, right? So these kind of features might be there. Or the patient may have erythrocytosis, right? In such scenario, the patient is eligible for the supplemental oxygen. So what you need to do is first check what is the oxygen saturation with the pulse oximetry on the monitor, what is the SpO2 on room air. You see that SpO2 is in between, is lesser than 88. Okay, it might be 83, 84 or 85, 86 or whatever it is below than 88, then you should think of doing the ABG. In those scenario, if the ABG shows PO2 value of more than 55, straightforward. Okay. Okay. So in that case, you need to see that is it between 55 to 60. If it is between 55 to 60, then you should check whether the patient is having cor pulmonale or right-sided heart failure, or the patient is having erythrocytosis. Right. If let's say your ABG, you did the ABG and PO2 was around 65, then in those cases you don't need to prescribe the supplemental oxygen. This patient will not need the oxygen support at home, right? So if the PO2 is less than 55, straightforward, you can decide that this patient will be needing the oxygen saturation, oxygen supplementation at home, right? But if it is between 55 to 60, then core pulmonale or erythrocytosis also needs to be checked. If that is there, then in that case you should be prescribing the oxygen to these patients. Okay, so you will be giving the supplemental oxygen. Ask the family members to arrange the oxygen at their home, and we need to make them understand that our target saturation will be again in between 88 to 92%. So give oxygen in such a manner that the titration of the oxygen should be such that oxygen saturation should be more than or equal to 90%. Okay, and then what you need to do, you will obviously ask them to follow up in OPD, and we will be rechecking it in the OPD. We will be rechecking the status of the patient. We'll recheck in 60 to 90 days, that means 2 to 3 months, and we'll assess whether the supplemental oxygen is still needed, or not, and if the prescribed oxygen is effective or not. So that is the scenario. That's how we prescribe the supplemental oxygen to the COPD patients. Thank you.